Dr. Timothy Quinn joins me now. He's a family physician and board-certified obesity specialist. Doctor, this is kind of scary to me. Obviously, we don't want fake drugs out there, certainly people not using them. So what can consumers do to help spot these fake shots?
Well, the first thing that needs to happen is information such as this network and other networks to let the public also be on the lookout as well. Now, the FDA is warning against this, what's being called fake Ozempic. And just to put it into context, Ozempic is the medication that's FDA approved for diabetes, but the ingredient semaglutide is also FDA approved for weight loss, and it's named Wegovy. It's manufactured by Novo Nordisk. But what the FDA is warning is there are companies out there that are making fake Ozempic, not the actual product that's FDA approved and determined safe. So individuals are getting this medicine, but it's not clear what's in it, and it might vary from one fake Ozempic to another, and some people are ending up in emergency rooms across the country. And then, like you said, there's also concern about sterility of the needles where people can get infected. So it's so important, if somebody is out there and you want to be on Ozempic, go be evaluated by a licensed medical provider. And that way it can be determined if the medicine is safe for you, if you'll benefit, and if you are determined someone that would benefit, you get a prescription, go to a licensed pharmacy for your best safety.
Yeah, I'm glad you mentioned the emergency room visits, not to scare people, but just for them to take it more seriously. Tell us a little bit about what signs of symptoms or illnesses they might experience if they use one of these counterfeit products.
Right. Some of the symptoms that are being reported are very similar to the actual product, which would be GI irritation. You can have someone with nausea, vomiting, stomach pain, constipation. But the take home is what's happening is, in my observation and speaking with local pharmacists, a lot of people are very desperate to get on these medications. And when they're getting them from sources that are not licensed medical providers, in a lot of cases, they're taking it incorrectly. Now, the way the medicine is taken, you start at a low dose, and every month you taper up very slowly, and it's evaluated if you're able to tolerate the medicine. But a lot of these individuals that are getting it illegally are taking it the highest doses first, and that's when they get the worst symptoms, and it's the most dangerous way to do it.
Yeah, great advice there. I want to move on to something that we see inevitably every winter, it seems, the new COVID variant spreading across the U.S. Researchers say it is now the fastest growing variant and the dominant strain. It's called JN.1. It now accounts for nearly half of COVID cases in the U.S. Doctors say mutations allow this strain to get by some immune defenses, although they still believe the latest vaccine will work against it. So what kind of symptoms does this new COVID variant have, if it's any different at all?
Well, most of the symptoms are pretty much the same that are being reported. You have your individual to come in, and we're seeing a lot of it in our clinic. People are coming in with cough, cold symptoms, body ache, fever, sore throat, loss of taste or smell. But the deal is, it's being reported that there's one mutation in this JN1. Now, it's a descendant of the BA2.86, but that one mutation gives it an advantage of that spike protein. That's the part of the virus that allows it to attach to human cells to infect the cells. So it's something that we want to be aware of. But what's being advised by the FDA is any individual out there, especially those that are immunocompromised, consider wearing masks, social distance, especially when traveling. And everyone should get that booster. The latest booster is being reported in the data to be effective against this new variant JN1. So just go out there and get that booster if you have not already done so. I know it takes about 2 weeks to get the full effectiveness of that booster as far as boosting that immune system.
Right, and people can do it now at the same time as their flu shot, which makes it easy, and there's real no excuse. Let's end with some positive health news, okay? Vitamin D, which we're hearing may improve brain functionality and strengthen memory. Researchers found that higher levels of the vitamin slow down cognitive decline. Vitamin D is known to strengthen bones and boost the immune system. So tell us about vitamin D. What makes it so beneficial?
Well, like you just said, the research is supported over the years, especially we talked about it during COVID. Get that vitamin D because it strengthens your immune system, and also your bones, helps you have less of a chance of broken bones. But what's being discovered in this latest research now, what they're looking at now is not just the serum level of vitamin D, but the actual vitamin D in the brain tissue. They're demonstrating that individuals that have adequate vitamin D in the brain tissue have better cognition, cognition. They have a better memory, which I'd like to have more of as well. So I'll get mine checked. But also a slower progression of cognitive decline. And this is the individual that might develop Alzheimer's later in life, especially if they have a family history. So this is something that's very fascinating. This is not being routinely done right now, but it's something that will lead to more research. And this is something that we in the medical community can use as a tool to help our patients.
We're showing video of these vitamins, vitamin D vitamins getting poured out. Obviously, real quick, is that the best way you think to get that vitamin D? Just grab a vitamin from your local store?
Well, it's a good way, but also we advise to go ahead and be evaluated by your medical provider, because there have been cases, and we talked about this during the COVID pandemic, where people took too much vitamin D, and this could be dangerous as well, because you can develop a hypercalcemic state, which could lead to kidney disease and other medical problems. So it's really a good idea to always coordinate with your medical provider.
Go talk to your doctor. It's always sound advice. Dr. Timothy Quinn, thank you for talking with us today.
Hey, thank you for having me.